One point of clarification, sort of by way of update. The macro law was passed April 16th, 2015, and although that was an absolutely horrible law, it had one good aspect to it, and that is you no longer have to renew your opt-out every 2 years. You do it once and it's permanent. The other thing is you no longer have to have your patients sign private contracts and update them every 2 years. We got written confirmation from CMS that you can have them sign it once, and that's the end of the private contracts. So we will take questions from the audience. Simply raise your hand, and Jeremy will bring the microphone to you.
Hi, I was researching the non-PAR status versus opting out, and from what I could tell on the CMS website, you still have to take into account the PQRS penalties, the meaningful use penalties, when determining what your limiting charge is going to be, which made the math very difficult, and for me it just made it seem impossible.
Do you address that?
What happens in terms of non-PAR is you're given from CMS the fee schedule, the limiting charge amounts, and it lists, there'll be 3 settings there. If you don't do electronic medical records, if you don't do PQRS, if you don't do the electronic prescriptions. Right now, that translates to a 6% reduction in the allowable charge. At the end of MACRA implementation, it will be up to 9%, and it's a zero-sum game. The people who do all of the hoops, if they can, which we don't think they can, will get a 9% increase in what their allowable charge is. The people who don't will get a 9% decrease from the baseline. So it is confusing until you get that price list, and then it shows you what that actual limiting charge is. You don't have to calculate it yourself.
But the 9% that you get kind of
Yeah,
cancels out.
and what I was going to say was the 9.25%, as Dr. Huntoon mentioned, the patient actually gets paid less than the participating provider physician gets paid, but the balance between that 9.25% more that you get is the patient's out-of-pocket expense. So you're getting 9.25% more being non-participating than participating, and when you need to be a participating for an indigent patient who only has Medicare, you have that option as well.
And that's unless you live in one of the states that have the limiting charge, state limiting charge laws, in which case you will be paid less.
I have 2 questions. The first question is, it is my understanding that if you disenroll from Medicare, that your prescriptions are not valid, that you're, as a disenrolled Medicare provider, that the prescriptions that you write, Medicare will not pay for.
You want to know my experience with it?
Yeah, I want to know your experience.
That has not been my experience with it. In all fairness, I have to add full disclosure that we sell our most commonly prescribed medications in order to get around all of the rigmarole and the time involved with, and we're able to sell them for less than the copays.
The second question I have is concerning, again, the disenroll option, and this is more of a legal question. If you are, basically providing the healthcare covered service to the patient, and under the understanding that they will then bill Medicare, wouldn't you still then be liable under the False Claims Act and all of the assorted laws and regulations that undergo with Medicare?
Well, I think that you certainly could be, and I think that if the government wanted to bring a claim against any one of us in this room for something, they could and would. So to me, that it's not an issue. But you said, though, just to clarify something, that we do not lead patients to believe they will be reimbursed from Medicare by filing this 1490S form.
No,
we tell them that it's available there, but that it will be turned down.
I'm speaking to the possibility that there becomes, that it becomes legal by way of an act of Congress that the patient can pay you and then be reimbursed by Medicare. In that circumstance, legally, you could be liable for the payment to the patient.
Well, what they would probably do is try to get me on the mandatory submission of Claims Act, but there is good legal argument against that, and that would become the basis for a test case, which I think we need to get into the court system.
Andy, do you have any
Yeah.
comments on that? I mean, because it's the patient that's filing the claim, not the doctor.
Yeah, that's right. I mean, the money would go to the patients in the case that Dr. Woodhams is talking about. So it's the false claim act really, the claim would not be against the doctor really, because he didn't get the money directly from the government. The money went to the patient. When you put the patient in the middle like that, it's almost never any crackdown by the government or by the government.
That's not my experience. I will say that, that I am, part of my case is actually payments that were never received by me, but were authorized by me as a physician.
Well, that could be part of it, but if that's the only thing that's going on, I would be very surprised if the government would ask for this. They may add that on as an additional claim, if they're coming after a doctor anyway. But I'd be very surprised if that's all the government had, if they would still come after the doctor.
From my experience, your argument that the patient's involuntarily paid into the system, this system is so broken, from my opinion, that basically they paid a card-carrying member of the Communist Party. I have no obligation to fulfill the promises made to them by traitors and liars.
I have a question for Dr. Woodham. I'm actually in the midst of starting a practice right around the corner from you in Dunwoody with it, so I probably will chase you down to.
Please do.
ask more
I'd
questions.
love to talk to you.
But my question at this point is, from what I heard today, I don't see any benefit to being opted out versus disenrolled.
I agree.
Am I missing that? Or
No,
is
no,
that-
that's what I think too.
Okay. I just wondered.
I think the reason that people think that is because our medical societies are telling us this. ASCRS, I'm involved very deeply right now with ASCRS and their government relations committee saying, basically stop telling our members this stuff, because it's, at best, it is, at worst, it is arguable, and at best, it's completely non-true.
Thank you.
The opt-out,
One
however,
point-
is a
one
safe,
point-
it's a safe harbor.
Yeah, the
Okay,
opt-out-
if you follow the rules, it's a safe harbor, whereas non-enrollment is in legally uncharted waters. And CMS does take the position that you're required to file claims for those patients, even though you're non-enrolled. That's their position. Hasn't been tested in a court of law yet, so that's kind of the situation right now.
Yeah, I will say that from a legal perspective, the safe harbor opt-out is, there is no possibility of CMS having any say whatsoever on what you and the patient do. There is no money that ever comes from CMS. It is a completely separate situation.
Well, except for emergent and urgent situations. Then you're essentially back in the Medicare system for those patients, and you can file claims and get paid from Medicare for emergency and urgent situations only.
Why would you be crazy enough to do that?
David McCaleb, St. Pete, Florida. Thank you for blazing the trails and helping us all. Can you tell us if you had Medicare Advantage contracts, and if you are aware of how it would impact a Medicare Advantage contract? Will they routinely kick people out who are non-par?
Yeah.
Is this a
Yes.
question for me? I mean, you say, do you have, if you mean, does one have these available to them in Atlanta? Well, of course.
They provide us a Medicare Advantage contract, and then you disenroll, and I assume you're going to lose a contract.
Absolutely.
Oh, I see. Well, yeah, sure you are.
Or you don't participate also.
Yeah, exactly. Sure. Right. Yeah, no, that's yeah, because that's part of the whole process is you're not, you're not discounting your fees or your work in some way. I mean, that would be a contractual agreement whether there was a Medicare program or not.
And in some cases, at least one case we're aware of, that insurance company retaliated against an opted-out physician and took the physician off all of their other panels because the physician opted out of Medicare.
If you are a non-participating provider, the physician pays you, and you file, and if they're in the Medicare Advantage, they don't get reimbursed.
And another thing to add to that is, and I am also completely out of network, so it's the same issue there, but I've actually had the opposite experience with insurance companies, is I can't get them to take my name off of the provider lists. So patients will call me up and make an appointment, and then they're unpleasantly surprised when they arrive to find this out. I've written letters, I've gotten an attorney to send a cease and desist, and they still do it. I don't think it's a matter of malevolence so much as just incompetence.
Why don't we take 3 more questions, then I think we have to move on to the next presentation.
I just want to make a comment because I've been participating, non-participating, and now I'm opted out. So I loved seeing the contrast between disenrolled for ophthalmology, and it's 1 year as of October 1st. And I chose to do opted out because of the prescription writing issue. And every state is different on whether or not you can do in-office dispense. And we recently had a battle with Texas Medical Board where they even questioned us giving post-op kits to patients as being illegal and in-office dispense. And we did win and settle. There was not a problem. But we are fighting for in Texas, and this I think is going to be important for everyone, to have in-office dispense, because if you theoretically with disenroll, they will disregard any prescriptions we write. So once I lose my ability to write prescriptions, I'm no longer a physician. So, I mean, I am, but I have the patient can't come to me. They need a prescription, they've got to go to someone else. If I have in-office dispense, I can have everything I need. I can be a surgeon, I can do the LASIK, and I sell them their medications at cost. I think getting in-office, and it's different from every state, and you need to know if your state is in-office dispense or not. The second thing with opted out is they sign the opt-out sheet once. I have to sign it, they have to sign it. It's not every time in every service. You have to know the difference between a secondary and a supplement. With a secondary insurance, for example, with an Advantage plan, if I wasn't an Advantage plan provider, I couldn't see them. Now I can, and if Medicare refuses it, that secondary plan, that's their Advantage plan, they can file and they can get reimbursed. So I have some plans where they're Medicare patients, but because I'm opted out, they use their Blue Cross Blue Shield secondary. There's an Aetna TRS teacher retirement plan. They can submit and they get paid, and I'm totally out of the loop. Also, TRICARE will pay 20 on supplements. Remember, there's a difference between a secondary and the supplement. The supplement pays the 20%. If you're opted out, the supplement won't pay. But TRICARE does, and so even if you do a cataract, the patient pays you, you're out of the loop. They can actually file with their TRICARE, and their TRICARE will pay 20% of the cost. So there's many different ways to do this. So I'm private, they sign the thing, they call opted out private contracted. I don't know which way is best. I see advantages to both, but I don't like the idea that later that disenrolled, they could come back and not do a prescription or something like that. But if we get in-office dispense, I may switch. I don't know.
Well, I have the advantage because there are 3 other doctors in the practice who have at least some kind of relationship, participating or non-participating. They could easily write the prescriptions for me.
Okay, let's just take 2 more questions, then we do need to move on to the next panel.
I am Melissa Clements. I'm a dermatologist. I opted out the first time in 1993 when the Clinton Omnibus Budget Reconciliation Act passed. And I have lots of comments to make, but I will observe that recently the law reads or has read that patients can file on their supplemental insurance policies. However, since I have not participated at any level in Medicare for decades, those secondary insurance programs do not recognize their patients' claims, and it's an enormous hassle, and the federal government does come after you, even if you are opted out. So I would say just because you haven't had the experience of them coming and saying something to you, it does happen, and it's not pleasant. Also, ancillary services such as pathology, which is covered by Medicare, that my patients in the last 9 months, certainly this calendar month, quite universally, have been denied pathology payment from Medicare because they don't have any evidence from me that something was done. So that is something that I am having to deal with, preparing the patient that this is a cash charge that you will have. I am also having increased difficulty daily being able to write prescriptions for compounds that have been common for decades and decades and decades, have been priced out of reach. For instance, 5-fluorouracil. If you write a prescription for Carac without giving them the magic pharmacy card, it's $2,996 for 30 grams, and that's insane. So I have a tiny office. I can't compound, but I do have relationships with physicians, or with pharmacies across the state that for the moment are able to provide Medicare eligible patients with things that I need to use daily in my practice. It changes all the time.
Okay, why don't we take Dr. Eskew over there as the final question, and then we'll move on.
May I make just one very brief statement? With respect to maybe them coming after me at some point, it's very good and useful to have broad regulatory protection policies. And we have one mag sells a very, very inexpensive one.
My question is for Dr. Woodhams. I'm guessing that you want to set some legal precedent, and that's part of your goal here. And if that's the case, when you've educated your patients about Form 1490S, and then they come back and they say, well, the government wants a statement from you saying that you're, disenrolled from Medicare, why not go ahead and give them that statement and let that attempt at precedent go forward?
Well, I may not approve of, or be willing to cooperate with the federal government, but I also don't think I should wave a red cape in front of them either. This is not my battle, it's the battle between the patient and the government.
Go ahead.
Hi, I'm Mary Helen Morrow. I'm from Texas. I have been opted out for 6 years now. The difference with opted out in a primary care setting, disenrollment is not an option. It is absolutely not an option. You have to be able to write prescriptions. You have to be able, and that covers x-rays you might want to order, referrals to specialists that you might want to order, the whole myriad of things. And what I can tell my patients, my Medicare patients, is you come to me and the only thing not covered is our visit. Everything else I can prescribe or order for DME, anything is covered by Medicare because I'm opted out. If I was disenrolled, none of it would be covered. And that's the problem with Obamacare when they were expanding Medicaid. If you didn't enroll in Obamacare, nothing you did was covered. So they'd see the doctor they wanted to see, then go to the pharmacy and not be able to fill their prescriptions. So yes, I agree, it probably needs to be taken to the courts, but I can't imagine any one of us wants to hang ourselves in the process.
Would you have any problem with telling patients, or any of you opted out doctors, letting them file a 1490S form and get it rejected and collecting it as part of a movement?
The sign with them says, and you will not bill, and
Right.
they cannot.
They can't do that.
Well,
They can't do that. No.
yeah, but if they do.
If they do, it's a red flag and they come after the doctor. Thank you to both of our panelists. Very interesting discussion today.